So these days, after surgery, the patient will be sent to the recovery area, and they start physical therapy straight away. Now, in the past, when we were doing these more in the hospital, they'd be there anywhere from 1 to 3 days. And I certainly still do a significant portion of the surgeries at the hospital. But we've gone to doing more and more outpatient joint replacement where there's no need to go to the hospital at all. And we use the same surgical techniques, but in our surgery center setting. And I think that the advance that sort of has allowed us to do this more than anything, more than the minimally invasive techniques, more than the robot, really has to do with the anesthesia and the impressive advances of anesthesia that have occurred really in just the last 2 or 3 years. They are now able to get patients to a point where they have a low enough degree of pain where they can get up immediately. And I mean like in the recovery room and walk around. At our surgery center, patients will have the surgery, recover right there in the surgery center, and after about 4 or 5 hours or so, on average, they get in the car and they go home. And our partners at RV&A Health have been so helpful in helping us rehab these patients, where they come out to the patient's house a lot of times before surgery and certainly the same day and after surgery to check on them, to make sure they're doing well and to help them start their rehabilitation. We do have now a capability of keeping patients overnight for 23 hours if it's appropriate. But I have to say, I think most patients will just go home that same day. So this is really, the most up-to-date sort of technique that we're using, and I'm really excited about it because I think this is the future of joint replacement. This slide shows the growth of our program. We started doing just a smattering of joint replacements as an outpatient case back in 2015, and we've steadily increased ever since. And here we are in 2020, already up to just about 100 cases. And that, keep in mind that is having had a several month period where we did none because of the pandemic.